Hello everyone, I'm Josh Gitalis, clinical nutritionist, and today we have Dr. Davis, author of Wheat Belly, New York Times bestseller, and cardiologist. And we're going to get right into it because we've got lots to talk about. And thank you for being here.
Oh, thank you, Josh.
Okay. My first question is, how many people do you think are sensitive to wheat?
I'd say something like 7 billion.
Isn't that everyone on the planet?
That's everybody on the planet.
Okay.
I don't think we have a human. Now, lots of people will say, but I don't feel anything when I consume a bagel or 2 slices of bread. So not all problems reach perception, of course. So many things can affect your health and you won't know about it. Can you have diabetes without knowing about it? Yes, you can. Can you have abnormal intestinal permeability without knowing? Yes, you can. And so I would argue that no human can escape. Now, some of us do reach age 85 and live just a fine life, but they're the exception. And we can't use the exception to disprove the rule. So I'll say, as a rule, humans had no business ever consuming the seed of this grass called wheat.
And when did we start consuming this seed?
I pick mostly on wheat because it's the worst of the worst, largely due to the efforts of agribusiness. But we first consumed wheat in the Fertile Crescent 10,000 years ago as the 14 chromosome einkorn. Though it was roughly speaking archaeologically, roughly coincident with the consumption of teosinte and maize in Mesoamerica and millet and sorghum in sub-Saharan Africa and rice in the swamps of Asia. So there was this odd, almost simultaneous development of agriculture worldwide between about 4,000 to 10,000 years ago. And that's when we saw explosive changes in human health. I'm always impressed that when you talk to any well-schooled anthropologist, they take it as common sense, common knowledge, that when humans consume the seeds of grasses, which they did, by the way, in desperation, when they ran out of the organs and meat of animals, and nuts and seeds and mushrooms and so on, they all know that humans developed all sorts of health problems. But most well-preserved, of course, in the archaeological record, explosive tooth decay, changes in the maxillary bone and mandible structure, and iron deficiency. Hemochromatosis, which is a disease presently genetically determined, was probably an adaptation to an attempt to adapt to the consumption of grains, because grains cause iron deficiency. The most common cause for unexplained iron deficiency in Canada, US today, is grain consumption.
Wow, that's interesting. So are there records of celiac disease? People having celiac?
There are written records, but nothing in the fossil record, because we don't have preserved intestines, brains, or livers. So there's written record of something that sounds like celiac disease dating back as far as 100 AD. And we know that celiac disease was likely very prevalent in the 17th, 18th, 19th century. So celiac disease is not new, but it has increased, of course. So we've seen this doubling over the last 20 years, a quadrupling over the last 50 years. Now, of course, our gastroenterology colleagues ask, well, what's different about us humans that would allow it? I think the question we ask is, what's different about the wheat and the proteins that provoke celiac disease that would account for a quadrupling of a disease in such a relatively short space of time?
And you mentioned that you said we don't actually have records of the intestines and the brain, and you mentioned a couple other body parts. So celiac disease, it's diagnosed by looking at just the gut, and it has to be complete villus atrophy. So you alluded to the fact that it might not just affect the gut, but other parts of the body. Can you expand on that a bit?
Sure. So that seemed to be a new phenomenon, new meaning 50 years or so, that celiac disease, this classic notion of malnourished, shrunken people who are underweight, that's much less common now. It's much more common for a celiac person on diagnosis to be obese, or at least overweight. It's much more common to show neurological phenomena, such as peripheral neuropathies, disorders of coordination that involve destruction of the cerebellum. It's much more common to have psychiatric illness. So there's a whole panel of non-intestinal ways that celiac disease shows up. So gastroenterologists, other scientists are looking for changes in humans to explain this change in presentation. of celiac disease. I would argue it's the humans. Humans haven't changed that much in 50 years, but the wheat has changed, and it has changed dramatically.
Mm-hmm. So, okay, celiac disease is at one end of the spectrum. Pretty simple to diagnose if it's at the later stages. How do we actually know if we are sensitive, if we're kind of in that vague area where it's not completely obvious?
Yeah, good question, because as you know, you're right, the diagnosis of celiac disease is fairly straightforward. You have antibodies that are identifiable, such as the transglutaminase antibody. And that, by the way, is because transglutaminase enzymes in the human body, liver, muscle, many organs, looks a lot like the gliadin protein. People say gluten, but it's really gliadin. Mm-hmm. It looks a lot like the gliadin protein of wheat. So we have this peculiar instance of so-called molecular mimicry, where gliadin of wheat looks a lot like the transglutaminase enzyme of the human body. So the immune system, once activated against gliadin, can't tell the difference, and so it starts to attack your body. And that's why we get such things as autoimmune hepatitis, biliary cirrhosis, dermatomyositis, polymyalgia rheumatica, because your body can't tell the difference between wheat proteins and its self-protein, in this case transglutaminase. Mm-hmm. So celiac disease, you just need a blood test. The gastroenterologists make their money by doing endoscopic biopsies of the small intestine, but you can pretty much make the diagnosis of transglutaminase antibody. We have this new situation, though. Dr. Fasano at University of Maryland, now at Harvard, and colleagues convened a meeting and said, well, what about all these people who seem to react to wheat? We think we're going to call it gluten sensitivity. An there's not a whole lot of proof that it is due to gluten, specifically in wheat, but it is due to something in wheat. Mm. A lot of those people have an antibody positive to the gliadin protein. It's a little bit different than the transglutaminase antibody. And so these people tend to have positive anti-gliadin antibodies. Now these are the people who have celiac-like phenomena, such as bloating, diarrhea, but don't have any of the histologic or the findings on when they have a biopsy of their small intestine. So that's the foggy area of. Now I would argue it ain't quite so straightforward, because I get concerned that that the world is starting to regard wheat as nothing more than a vehicle for this protein called gluten. It would be like saying humans are nothing more than a vehicle for transglutaminase enzymes. Mm-hmm. Now there's a lot more to a human than a single enzyme. There's a lot more to wheat than there is this single protein called gluten. And so we've got to look beyond gluten, because if we think of wheat only as a vehicle for gluten, we're going to say things like, well, you got a negative transglutaminase antibody and a negative gliadin antibody. Maybe wheat's okay for you.
Mm-hmm. Right.
But we've neglected all those other things in wheat.
Mm-hmm. So I would say that completely cutting out all glutinous grains would be a good way to see if all those symptoms you talk about in your book actually resolve. And I guess from your experience and talking to people and being all over the world, how quickly do people notice a difference? And if it's not quick, how long can it take to see a difference?
What I find, Josh, is the response depends on the condition. Mm-hmm. So if we remove all the components of modern wheat, we get relief from acid reflux and the bowel urgency of irritable bowel syndrome within 3 to 5 days. We lose simple arthralgias or joint pains, particularly in the fingers and wrists, within 3 to 5 days. We lose the abnormal appetite stimulating effect of the gliadin-derived opiates in wheat within about 5 days. More complex phenomena require a longer period of time. So the autoimmune conditions, lupus, rheumatoid arthritis, Hashimoto's thyroiditis, polymyalgia rheumatica, all those about 75, 76 conditions, those require a minimum of several weeks, but more commonly several months or even longer. The longest to respond of all are neurological phenomena. And those are toughies because they don't always respond completely. Neurological tissue is not very good at healing and recovering. So it takes months and even years, say, for peripheral neuropathies, cerebral ataxia, and seizures. Temporal lobe seizures is a disease of wheat consumption largely. Those can take months, even years to resolve. I tell you, more and more, as more and more people do that, we are seeing rapid responses too. I just talked to someone yesterday who said her temporal lobe seizures that were coming once a week disappeared within about a week. So that's surprisingly quickly for a neurological phenomenon. But the answer to the question is the time course depends on the condition.
Okay, great. And because you're a cardiologist, what's the connection of wheat with heart disease?
Yeah, big deal, because we know heart disease is the number one killer of men and women. It's a hugely prevalent disease.
Mm-hmm.
And we're told that heart-healthy diets are low in fat, rich in healthy whole grains. Well, that's like saying the best thing you do for lung health is to smoke a pack of cigarettes a day because it makes you breathe deeply. And it's just so absurdly contrary to everything that truly works. So the amylopectin A, that's the complex carbohydrate of wheat that acts worse than table sugar in raising blood sugar. That also, in parallel to high blood sugars, also provokes formation of small LDL particles. Small LDL particles are also very oxidation prone. That's the real cause of heart disease. So people consume healthy whole grains have sky-high expression of small LDL particles. The lectin protein of wheat, a protein called wheat germ agglutinin, is highly inflammatory. Most of it stays in your intestinal tract and just does its damage as it passes through the other end. But a little gets through into the bloodstream. We know this because a lot of humans have antibodies to wheat germ agglutinin. And that little microscopic quantity that gains access to your bloodstream is highly inflammatory and thrombotic, blood clot causing. The amylopectin A also causes high blood sugar accompanied by high blood insulin. And that repetitive cycle of high blood insulin, breakfast, morning, dinner, snacks, before bedtime snacks, that constant cycling of sugar and insulin causes visceral fat growth. And we all know that visceral fat is highly inflammatory. So I would say if you want heart disease, you should eat healthy whole grains. And if you don't want heart disease, one of the most important things you could do is consume no grains whatsoever.
Wonderful. So in terms of testing, the standard test that they usually do when you go for a checkup is glucose, blood sugar, and cholesterol, which actually doesn't look at the different types of cholesterol, the small and the large particles. So are there any tests that look at the effect of these blood sugar fluctuations other than just blood sugar?
You can use blood sugar after you eat also. So that's one thing I tell a lot of people really engaged in diet and wanting to understand the impact of various foods can take a blood sugar just prior, a little finger stick device you buy, a blood sugar just prior to a meal, and then a blood sugar that approximates the peak blood sugar, which should be around an hour. It's not always an hour, it depends on the mix of foods, protein, fat, fiber, pH, liquid, etc. But the peak is usually around an hour. I stress that because a lot of people say, but my doctor said if I want to check my blood sugar, check it at 2 hours. But what they're telling you is check your blood sugar to see how well controlled you might be on drugs. We're trying to have nothing to do with drugs here. And so all we want to know is the peak impact. And so it's more or less at about an hour. And so using that value tells you the glycemic impact of a food. I would argue that ideal is no change whatsoever. So if you start, say, at 90 milligrams per deciliter or 5 nanomoles per liter, you eat food X, you want 5 or 90 milligrams per deciliter. You don't want 90 going to 193 as it would with 2 slices of whole wheat bread or a bowl of oatmeal or something made of cornstarch. We don't want those kinds of rises in blood sugar. Those are very, very unhealthy. Another way is to do a hemoglobin A1C, which is just a long-term reflection of blood sugar fluctuations. Now, what I would not do is follow conventional notions. It's very typical for primary care physicians to say, well, you're 6.5% or less, you thereby don't have diabetes, you're therefore good. In other words, I don't think we can use the definition of not having diabetes as a definition of health. I would ask the question a little bit differently. Where in the spectrum of values of hemoglobin A1C does all excess risk from that value dissipate? And it's 5.3% and less. I would argue that if you and I were wild Homo sapiens running naked on the savannah of Africa, would have hemoglobin A1C values below 5.0%. So that's what I try to do with people. Tell them, if you want ideal health, you want a hemoglobin A1C of 5.0% or less. Certainly no higher than 5.3%.
Wonderful. So give me a quick breakdown how to keep our hemoglobin A1C there. 3 typical meals in a day.
Well, so grains would be, interestingly, we're told over and over again, cut your fat, eat more healthy whole grains. Of course, we all know we have the worst epidemic of diabetes now, and overweight. The worst epidemic ever witnessed in the history of the world.
Yes.
So, clearly there's something wrong with this message. And of course the grains have been changed. So we take all grains out. Now, a wonderful side benefit of going grain-free. By grains I mean wheat and its cross-reacting friends, barley and rye, and its lectin relative, rice. So the lectin of wheat, barley, and rye looks too much like the lectin of rice. Corn's got its own set of issues, like the zein protein that looks a lot like the gliadin protein, also high starch. So we could argue that, gee, just about any seed of a grass, that's what grains really are. They're seeds of grasses. We can't eat a full grass plant. We can't eat its roots. We can't eat its blades, its leaves, its stalk, its husk. So clever humans many thousands of years ago figured out if we eat the whole grass plant, we get real sick. We have diarrhea and vomiting. So all we can do is eat that little seed. That's all we can eat. And we first have to pulverize it and heat it before it's even digestible. So smart humans figured that much out, but only now we figure out, well, you know what? There may be no acute illness in a lot of people, but there's lots of chronic complications of eating that. So first step, no grains.
Okay.
Now, removing the gliadin-derived opiates, the gliadin and other grain-derived related proteins, removes the appetite-stimulating effect. So most people go grain-free, say, I thought I had to eliminate sugar, and I did it naturally because I lost my taste for sugar. I no longer desire candy bars or soft drink because I took away that opiate that was driving that effect. So grain-free is followed very naturally by most people by lost taste for sweetness.
Okay.
So those are the two biggies in heart disease, and weight gain, and diabetes.
Okay. So what would be one last thing you would say that everyone should remember, the key takeaway?
So recognize that humans never were meant to consume the seeds of these grasses. We did so in a moment of desperation. We ran out of the organs and meat of animals and nuts and seeds, and we cleverly figured out how to make it palatable, edible, and only now we're seeing the adverse effects of that mistake. Now, I think we're seeing it more than ever before because geneticists entered the picture. They took something that was inappropriate for human consumption, the seeds of grasses, changed it, and amplified, exaggerated adverse effects on humans. Now we're seeing explosive problems. Compound this with advice from Health Canada, the USDA, eat as much as you can of it. Now we see the explosive problems of psychiatric disease, dental problems, ADHD, autism, weight gain, diabetes, cancers, heart disease, dementia. So I hope if we make mistakes, we learn from our mistakes. And this mistake was that the seeds of grasses never belonged in human diet in the first place.
Wealth of information. Thank you so much for being here. I could talk to you for days. And I understand you're on a tour now, spreading the news.
Exactly right, Josh.
Yeah.
This is the Cross Canada Experience Wheatlessness Tour. It's an effort to feed this movement. This is not really about a book. It's about this movement of enlightened people who now have their eyes open and realize that the prospect of ideal health is now open to them in this world minus grains. So we're going to talk about that on our tour that starts in Toronto, Niagara, Brantford, and then we take it out to Montreal and the West Coast.
Wonderful. So they can find that information out on your website?
That's on ideafestival.ca.
Okay, ideafestival.ca. You can see Dr. Davis live and learn way more that we talked about and how, most importantly, to apply this to your life. Thank you so much.